Hello and welcome to Health Services 411, a program designed to keep you updated, informed, and educated about activities, events, and policies of the BVI Health Services Authority. I'm your host, Marketing and Communications Manager, Natasha Ledsam. As the BVI Health Services Authority continues its quest for delivering excellent client-centered healthcare, for today's 411, the Division of Nursing presents Enhancing the Patient Care Experience. We're here with one of our registered nurses, Miss Janet George, and she is one of our nurses who's in charge of nursing education. Thank you for coming on the program, Miss George.
Thank you very much for having me.
Now, we understand that you had a training today with regards to patient care. Tell us a little bit about that training.
Okay, the training that we did today, it has been ongoing. Basically, it's about nursing documentation and also trying to get the nurses to document with a jury in mind when they do actually document on patients.
Mm-hmm. So how will this training benefit nurses as well as the Health Services Authority?
Well, as it relates to nurses, our hope is that nurses will be more vigilant in terms of the documentation, that when they do document on their patients that they're providing care for, that they will, be very consistent in the care that they provide, also be very, basically that their documentation will be in an integrated manner, in that they are working with other nurses and other health professionals. In terms of the nurses, in terms of their benefit, is that I'm actually trying to get them to understand the legal ramifications of how important documentation is as it relates to documenting on their patient, because at the end of the day, if they do something for a patient and it is not written or documented, it was never done.
And as the BVI HSA continues to seek to deliver excellent client-centered healthcare, how does educating your nurses fit within that whole parameter?
The BVI HSA, that we continue to just provide that consistent, quality, client-centered healthcare, because at the end of the day, our main focus is that we do provide that client-centered healthcare, and in terms of educating the nurses, hopefully this is what will result in terms of the care that we provide to our patients on a daily basis. Our care should be consistent, it should be quality healthcare, 365, 366 days a year, every day, all day, continuously providing that care to our patients.
It is my responsibility to not only protect myself, but protect BVI HSA and to protect the person that I'm giving care to 100%.
It is accurate, it is concise, that we document the pertinent details as it relates to our care, as it relates to the care of that patient. Because if we do not document, then no matter how much care we would have given that patient, it was never done. So we need to ensure that we document on all of our patients, that our documentation is done in an integrated manner, because that documentation really provides evidence of our care. And that documentation, like you just stated, it can be our best friend.
Thank you for tuning in to this edition of Health Services 411. Please like and share this video and follow us at the pages below as we seek to improve the pulse of the people of the territory. Until next time, remember, your health is your wealth. Reporting for the BVI Health Services Authority, I am Marketing and Communications Manager, Natasha Ledsam.